Here's a topic that generates a lot of anxiety among infertility patients that are finally pregnant, especially those that have gone through in vitro fertilization, and that is bleeding in the first trimester. A very common phenomenon, very worrisome phenomenon. So let's discuss it. Hello, everyone. I'm Dr. Eli Reshef. I'm a reproductive endocrinologist and infertility specialist, and this is a topic that we encounter very often. In fact, after in vitro fertilization, about a third of patients will experience bleeding in the first trimester. Clearly, after the emotional, physical, and financial investment in vitro fertilization, you as a patient who is now bleeding have great concern about the welfare of the pregnancy, and we as physicians must listen to you very carefully. There is no room here for platitudes and saying things over the phone such as, hey, don't worry about it, it's common. Let's wait until your 6-week ultrasound to confirm heartbeat. My philosophy is you will be worried unless we address it very promptly. And addressing it promptly meaning let's see you for an ultrasound as long as it's done early enough or late enough in the first trimester that we can see a gestational sac. But even without that, you're concerned about the welfare of pregnancy, are concerned about the welfare of your pregnancy, and also for ectopic pregnancy, tubal pregnancy, should behoove us to see you as early as possible. Do an ultrasound, check your blood levels of HCG and progesterone when indicated, and hopefully provide you reassurance. So once again, if a patient of mine complains of bleeding in pregnancy, I do usually ask how much compared to a regular period. Is it brown discharge? Is it bright red blood? Is it accompanied with significant pain, especially on one side or the other? But invariably, I need to see that patient as soon as possible. The good news is that the majority of people who bleed in early pregnancy will end up with a live birth. Yes, there is some increase in risk of miscarriages in people that do have bleeding, especially when we see what we call a subchorionic hematoma, a fancy name for bleeding underneath the placenta in the uterus. But once again, remember, the majority of you who bleed in the first trimester will end up with a normal pregnancy. You need to keep that in mind. I would like to provide you reassurance by doing an ultrasound, and there's nothing more encouraging to patients when we point out to a heartbeat when it's late enough in the first trimester we can see it, usually at 6 weeks, and say, hey, there's still a reason for concern, but your pregnancy is doing well. So things to check, of course, is if it's late enough in the first trimester to be able to see a gestational sac, normally at 4.5 weeks, 5 weeks, we should make sure that it's present, because bleeding in that phase of pregnancy may signify a pregnancy not in the uterus, what we call ectopic pregnancy, more commonly tubal pregnancy. Once we see a gestational sac in the uterus, even if it's early enough before we can see a heartbeat, it's a reassuring sign, even if we see bleeding underneath the placenta. And of course, close follow-up is warranted. We need to make sure that we know your blood RH status. Typically people with RH negative may be offered what we call RhoGAM in order to prevent immune response to the next pregnancy. But I know that you are so worried sick when you invested so much. So it is my duty as a physician, and your physicians should hopefully follow suit, to see you as soon as possible. I think we need to leave this conversation on a positive note. The majority of people with bleeding in the first trimester, especially if the pregnancy is inside the uterus, will end up delivering. Normally, there may be some increased risk of low birth weight in people with twins, and of course, more increased risk of what we call the vanishing twin syndrome in people with twins in whom one of them did not survive, but that usually doesn't drag the other one with it. So once again, call your physician if you have bleeding in the first trimester, and hopefully they will address it with the utmost respect to your anxiety and your investment. Thank you.